Continue.
Okay, we'll give it a few more minutes and then we'll begin. We're
Okay.
continuing on from where we left off last week. We left off with patient portal, how to use it, the benefits of it. And today we'll continue on with something similar called telemedicine, telehealth. And that is all to take care of your health needs virtually, whether it's by telephone or by computer. That's the direction where the world is going in as far as healthcare.
Yeah.
And there, of course, there's the pros to it, which is why it's been introduced, but with everything comes negative, which is the con. And so we'll address the pros and then we'll look at the cons and how it may impact you as a patient.
Mhm.
We'll be doing our three door prizes again today. These will be Walmart gift cards, compliments of Lou. And let me get my slideshow ready. Nope, the current slide. If there anybody there that's using iPad, please let me know. Perhaps I can help you change your change it to your name before we get started. Because Isaiah will be taking names today,
For what?
assigning numbers to them.
Uh-huh.
Okay, the person with the BB, you may want to change your name, or if you don't care for door prize, that's okay. You can keep it as BB. Okay, couple more minutes and then we'll go into how many of you has began or had a virtual visit with your provider recently or ever had one? I see one hand, two hands. Okay, three. So you're already using the system then.
Yeah.
Tomorrow.
You've been using it. Perhaps
Yeah.
you can give share with us towards the end what your experience was and would you recommend it? Would you be willing to do that? Talk about it?
Yeah.
Yeah.
Good. All right. All right. So again, we left off with patient portal last week. We're going to continue on in the area of telemedicine. Okay. So what is telemedicine? Let's find out.
Get my pen.
Telemedicine is actually part of telehealth. So we need to find out exactly what is telehealth and then break it down to what is telemedicine. Telehealth is the broad term for all healthcare services that use telemedication, including telephone alerts regarding diseases and outbreaks. Okay.
Military to help them as they fight against this invasion. And I thank the Congress for appropriating these funds.
So telemedicine is a subset of telehealth. It is used for, again, telecommunications to provide clinical services to patients. Okay, although it's worth noting that these terms often use interchangeably.
We have identified
What I want to do at this point is, let's go back. Oops, went back. And
I knew assistant.
back.
Telehealth.
I want to run a short video, very, very short video on
YouTube.
yeah, on YouTube.
Telehealth.
So you can hear it from the horse's mouth, in other words. And that way it would be, let me stop the slideshow and the slideshow for now. I'm going to run this it's very brief. I think it's a couple minutes long. And so you can get here. It kind of puts it in a very simple way to understand what is telemedicine.
8. 8.
And then I need to share. Now, can you see it? I'm setting up the video. Can you hear it? Can you see it?
Nuh-uh.
You can't.
I can
That
see
means
it. I
need
can
to
see it
reach-
being set up.
Okay, good. That means you are seeing my screen then. Okay, you can see it now, right?
Telehealth.
Okay.
Yeah.
Hold on, let
Is
me
it?
expand it,
Uh-huh.
make it bigger so that everybody can see it.
Okay, right
Okay,
there.
and let's start. Okay,
Many of us are staying at home to stay safe from the coronavirus, which
Mhm.
causes COVID-19. Our friends and family are staying home too. That means we can't visit them or have them visit us at home. But we can still visit with them on the phone or by using a computer, tablet, or smartphone. The camera on these devices lets us see each other while we talk and visit, sort of like a video. When we meet using video, we call it a virtual meeting or a video meeting. Healthcare workers like doctors, nurses, and therapists are staying at home to stay safe too. But what if we need to see our healthcare worker? Well, we can also have a virtual meeting or video meeting with that person. It can be over the phone or by using a computer, tablet, or smartphone. A virtual or video meeting with healthcare workers is called telehealth. With telehealth, we can ask our healthcare worker questions, tell them if we feel sick or have pain, ask them about our medicine, get information, or anything we need to stay healthy. Now that you know what telehealth is, you can watch our other videos for tips on scheduling a telehealth appointment, preparing for your telehealth appointment, and participating in your telehealth appointment so that you get what you need to stay healthy.
all right, so let's go back now to our slideshow. Can you see my slide?
Yes.
Yeah.
Okay, good. The sharing's
That's it.
continuing well. So we'll go back to slideshow from current.
8.
So we just learned what telemedicine is. It is
YouTube.
a subset of
YouTube.
telehealth. And so there are different types of telemedicine. So we're going to look at those. There's what is known as remote patient monitoring, short RPM. It allows healthcare providers to monitor patients' health data from afar, usually while the patient is at their own home.
Oh.
Then Again, RPM can significantly cut down on the time a patient needs to spend. So this is another reason for the remote patient monitoring, because it can significantly cut down on the time a patient needs to spend in the hospital instead of letting them recover under monitoring at home. So their patient is sent home and provider continues the care via remote patient monitoring. That's part of the remote monitoring. Remote patient monitoring is especially effective for chronic conditions such as heart disease to diabetes to asthma. They can take care of all of this basically from the comfort of your home. Of course, with the right equipment in place. So because of technology, patients are able to monitor themselves. I'm sure many of you take your blood pressure daily. So with today's vital healthcare data, it can be shared with your doctor and other healthcare professionals remotely. A couple of weeks ago, I had a virtual visit, and the first thing they said, "Oh, did you take your blood pressure today?" So they're asking questions like that when they do these virtual health. They want to know those numbers. For telemedicine, you could set up appointments, and other healthcare professionals can conduct virtual appointments with patients. Again, it could be conducted over by phone or video, for example, Skype, FaceTime, or Zoom link, or some other method of streaming.
2 pizzas, breadsticks, and wings, all in one box. The big dinner box.
Okay, we've got somebody with a TV coming in. Let's see.
Okay.
Make them mute them.
Uh-huh.
Okay. All right. So additionally, some systems allow patients
You too?
No, the guy in the building, they said it only can have 4 people in there. They stuck.
The lady
Nah.
Cynthia.
I found it.
I know, I got it. Thank you very much. All right. So additionally, some systems allow patients to send photos to their doctors using integrated software, allowing their doctors to see areas of concern more clearly, such as moles, burns, or bruises. So again, you can send images if you've got any issues like that. Telehealth may include the use of a home monitoring system that makes it easy for doctors to ask the patients the important health parameters, such as your heart rate, your blood pressure. And some telemedicine tools include the use of a chat bots and automated algorithm. So here are some of the tools here that are used from the home. You have your blood pressure. I guess this here on the phone is the actual meeting that's taken place. You could take your temperature. So different telemedicine tools that can be used during the visit.
Teresa, what is a chatbot and automatic algorithms?
Okay, so a chat box, okay, let's go back. A chat box, just as the name says, where you could be chatting with your virtual, with your provider.
But is it bot? Doesn't that usually mean robot, chatbot?
Well, yeah, it's a robot you're chatting with. It's an actual robot. You're telling the robot what is going on, robot is responding. That's a chat bot. And the next one you have there to an automated algorithms. Well, software has now come to where, based on what you enter into that chat bot or what information you share, an algorithm then discerns what the problem is. And then if there's a need for further, then the real person comes on, either with a callback or whatever. So let's say you're not feeling well right now. You contacted your virtual your provider. Right there and then, they may not have a nurse to ask you questions at that very point, but you will chat with a chatbot. The chatbot will then take that information and they will schedule an appointment in the very near future, like in minutes or whatever time, for a real person to come on board. So the chatbot is more like the, who would you say, the triage, right? Triage nurse that determines or take your vitals or do whatever, and then hands you over to the doctor. The algorithm is what determines what is being said and how to put it in medical terms for the next interpretation. So who's writing the software? It can't be just software developers. It's got to be medical people, scientists that are actually putting these algorithms together for these medical determination. Yeah, not just regular folks like you and I.
Okay, thank you.
That answers your question?
Yes, thank you very much. Thank you.
All right, so there are the pros and the cons of telemedicine. When weighing them, you have to realize there's no doctor or service is perfect, right? Errors are possible in all methods of healthcare delivery. You see my Y there. So, and it even happens when you're there in person. I'm sure you've at some point experienced some error that was made on your chart or within a visit, and you had to let them know, no, they're wrong. That didn't happen, or, or so forth. I remember I was going in for a colonoscopy once, and the wrong chart was sitting next to me. And when they read off my name, I said, no, that's not me. Oh, and then they apologized, but it does happen. So clearly, telemedicine protects both patients and doctors from dangerous germs. As the world fights COVID-19, healthcare workers are at great risk. And I feel for those healthcare workers. You're going in there, or we're going in there with this horrible disease, and they're having to treat us. That means they can take it home to their loved ones, and many have done so, and many have passed away since COVID because of this. So it's very tricky. So telemedicine does help. Clearly, it is best for everyone, including the greater community, if patients who suspect that they might be infected stay at home, but that isn't true for COVID-19. Keeping sick patients at home when their conditions allow helps reduce the spread of any type of germ. Certainly, a benefit of telemedicine is that it can help patients get medical care without leaving their home. That's the purpose for it. All right, so what else is telemedicine does is improve access to doctors. Since there are widespread shortages of doctors and other healthcare providers in both rural and urban areas, telemedicine provides access to services and doctors that would otherwise be nearly impossible. So you live out, well, none of you do because you live in DC, but let's say you had loved ones living out somewhere in the boonies, telemedicine can help them with certain things. Of course, not everything, but similarly, patients with rare diseases can connect to hard to find specialists who are too far to see in person. For instance, many patients don't have access to a geneticist to diagnose rare genetic disorders, and telemedicine can bridge that gap. So why would you want to travel to your doctor's office and wait in the waiting room for 20 to 30 minutes when you could wait for your telemedicine appointment while at home or at work? Why would you? Okay, it can be a waste of time and money to go also to the doctor or the ER if your health doesn't require in-person visit. With telemedicine, you can speak with a doctor from the comfort of your home or job, and together you can decide whether you should really come in to see the doctor or go to the ER. So that's the first step. I don't like going to the ER just because I don't find it. It's a horrible place to go to. And then you pick up a lot of viruses in the ER, you know? Telemedicine can reduce or contain healthcare spending by increasing efficiency via better management of chronic diseases, reduce travel time, and fewer or shorter hospital stays. Since so many of us have high deductible insurance plans, as well as responsibility for a portion of each bill, lowering healthcare costs helps us all. Telemedicine has the potential to improve the quality of care by making it easier for providers to stay engaged with patients. Additionally, when doctors remotely track a patient's health via monitoring systems, they can identify problems as soon as they develop. I don't know if any of you have any of those remote systems in your home where your doctor can track these things. And again, that's where algorithms come into place. Actually, will notify the doctor, here, there's something going on with this patient. Okay, so let's look at those. We just looked at the pros of telemedicine. Now we're going to look at the cons. You can't get a physical, right? Firstly, it goes without saying, physical exams are impossible via phone or the computer. And of course, there are circumstances when an in-person visit is essential for a diagnosis and treatment. For instance, doctors on the phone or the computer can't feel the swollen glands or look at throat or noses to test for COVID-19, strep throat, or other infections. They can't. So additionally, doctors can't screen your blood pressure or your cholesterol levels over the phone. In fact, the decrease in number of in-person doctor visits due to COVID-19 led to a significant decrease in cardiovascular screening, both important for the prevention of heart attacks and strokes. So when COVID came into place and you couldn't go and really see your doctor like you used to in the past, look what happened. You know, cardiovascular screening became limited, and it's and as I said, it's important for the prevention of heart attacks and strokes. And that is true. You go to a doctor, and at that time, if your blood pressure is really high, they can check your blood pressure. Not only can there's also, I remember a few years ago, they did a scan on me, and they actually told me that I was having a mild heart attack because I was right there. They could see on the graph what was going on. They can't do that from home. So that's an example of where it's not effective. It just doesn't work in all instances. All right, so research compared primary visits in the second quarter of the 2020 and the second quarter of 2018 and 19. Remember, the second quarter of 2020 is when COVID all started to peak up. And they found that blood pressure checks dropped by 50.1%, cholesterol level tests fell by 36.9%, and new medication visits decreased by 26%. All because of virtual visits, are not being able to get to the doctor and personal. So there's another reason why these virtual visits are not convenient for some. Unfortunately, it can be difficult, if not impossible, for lower income, I'm missing a word there, lower income people to take advantage of video calling for telemedicine appointments. Oh, look at my typos, really bad today. You look at the, I said appointments. That's also a typo there. And what that's not the case because you now have access to your iPads that allows you to do videos. So, but before you had those iPads, you couldn't possibly do a virtual visit to the doctor because you didn't have access to technology. So they're saying, in fact, a 2020 study of telemedicine appointments among the lower income patients found that most of the telemedicine appointments were conducted over the phone. You could talk, but they couldn't see you face to face. And these are for people who did not have access to an iPad or a laptop or a desktop. You might not know that the doctor on the other side of the phone, you also in a virtual setup, you may not even know who you're talking to. As mentioned, the doctor you speak with during a virtual appointment may be a stranger to you, since some doctors use outside telemedicine companies to provide virtual care for their patients. Now, I wouldn't want to be a part of that, I'll be honest. Additionally, many employers now provide telemedicine services for third-party vendors as part of their benefit offerings. So instead of you having your own personal doctor, you're dealing with somebody who's perhaps using an algorithm, just like a robot, to determine what's going on with you. Because they don't know you. They don't know your health records or anything. Here's another downside to virtual health care. When patients meet with doctors in person, it's easy to stay focused on the conversation. However, when patients have telehealth appointments, the opportunities for distraction are endless. And these distractions can lead to less engagement, which can negatively impact your health and care. So that's another no-no to it. Even though your appointment is via the telephone or computer, don't just sit back in your favorite TV chair and relax. You need to prepare for these appointments the same way you would prepare for any in-person medical appointment. For instance, write down your questions prior to your appointment. Have a list of medication taken along with a record of your symptoms and side effects. This is if you're having a virtual. So let's look at all the different techniques of a virtual. Is a phone call considered telemedicine? Generally, telemedicine is not audio only telephone conversation. It involves as well emailing, instant messaging, conversation, or by fax. What are some of the examples of telemedicine? So let's look at some of them. A virtual visit with a healthcare provider through a telephone or a video chat. Remote patient monitoring, which lets your provider check on you while you're at home. A surgeon using a robotic technology, surgery from a different location. These are some examples of telehealth. Telemedicine carts usually come equipped, and I'm sure when you're there in person at the actual providers, you see things like computers, monitors, keyboards, cameras, mobile medical devices like digital scopes and wearable monitors. Hospitals are also increasingly using technology like interactive patient engagement systems to improve their patient education and streamline workflows. So telemedicine is the future. That's the direction we're going in. All right, so how do I set up a telemedicine? Well, you call in and you say, I'm not feeling well. I'd like to have a virtual visit with your doctor. And this is what it may entail. You view your video, they'll send you a link and you download the link. You make sure your audio is working like you do now in Zoom. You make sure your video is working like you do now in Zoom. And they also give you a number that if you're having problems, you can call. There's usually a number, it comes with that. And you view your video visit confirmation, then you join, and then you wait for the meeting to begin. It's just like Zoom, but your provider's on the other end. All right. How to set up a telehealth consultation. Well, I'm going to show a short video on how, well, the video is 6 minutes long, but I'm not going to show all of it because we don't need to be watching a video for 6 minutes, but just to give you an idea of how it actually happens, the actual visit, for those of you who've never experienced it. So let me end the slideshow for now. And then I am now going to go to my video that I had set up. I think what, yeah, this is it. I'm going to go, I'm only going to run like a little bit, 2 minutes of it. Hold on a minute. Let's get it.
Review the
So
steps
let's
to connecting
say-
with your provider at Crystal Run Healthcare
Hold
via
on.
telehealth. Crystal Run Healthcare uses the
Hold on, why
HIPAA-compliant
is it
version
I
of the
can't
Zoom
set this
application
up?
to perform
Hold on.
telehealth visits. In preparation for your visit, please install the Zoom application on your device that you will be using for your visit.
Let me start it again
You will be
from the
invited
beginning. I'm only going to do 2 minutes of
join
this
your
actual
telehealth
video,
visit into
so you can see what it's like. How you're in the visit. This video, you'll learn how to download Zoom app on whether it's or on an iPhone. Okay, so these are the steps they're telling you how.
Review the steps to connecting with your provider at Crystal Run Healthcare via telehealth. Crystal Run Healthcare uses the HIPAA-compliant version of the Zoom application to perform telehealth visits. In preparation for your visit, please install the Zoom application on your device that you will be using for your visit. You will be invited to join your telehealth visit in 2 different ways. You may receive an email or a text invite at the time of your appointment.
This is how
Text
it
message
looks.
contains a link. Click on the link and follow the prompts to review and update your demographic information. Once complete, you will see a link to join the provider for your appointment. The other way that you can be linked to your provider for your telehealth appointment is that you will receive a personal meeting ID by the clinical team at Crystal Run Healthcare. Your provider's clinical team may call you prior to the visit and provide you with the meeting ID. You can use the meeting ID to join the visit if you have not received the text link. To prepare for your visit, you should first begin by installing the Zoom application on your Android or iPhone device.
And these are just the instructions. So I'm going to stop there.
We will now review the
I'm going to
steps to
stop there
download the
because
application.
that's basically just going in. So that's basically how it comes. You're sent a link either text-wise or email-wise, and it actually prompts you on how to, set up and be ready for your actual virtual visit. So going back now to my PowerPoint, I think I've come to the end of that. Yeah, that was it actually, to the end. So now I'm going to invite those with their hands up. If Alicia, if you'd like to share what your visit was like, and would you do it again, so that others can get a feel, is this something I really want to participate in? So go
Well-
ahead and take the mic.
Okay, I joined the GW system a couple of years ago at the urging of my social worker. So I'd had a couple of real physicals, like an annual. So then when COVID came, not only I'd met the woman one time before, it was at the satellite clinic here on the corner of Porter and Connecticut. And she was good then. And she got the tests lined up for me and that I had to take, like the DEXA scan and all that. But the second time last year, must have been 2020. Yeah, no, last year, she was pregnant. Not only was she pregnant, she was on home leave for 3 months. So there was no way to reach her because she was not going to be coming in. And so they did set up a telehealth with me. She couldn't do much. She made a few she ordered a few tests, but then I found out later, not only she billed me for the test at the time she ordered it, and they billed me for it again at Washington X-ray. So I had to follow that up. So that was one thing. And the second thing was when I got my results from the DEXA scan and other scans, there was no way to reach her, to ask for and I said, I know I watch how much they charge Medicare. And it really bothers me. I'm not going to ask for another appointment to have her read me the things online when it probably charged Medicare $500 for that. I don't know what they charge Medicare, but I know that at least I got that one bill, about a $300 or $400 bill off the list, but I would not do it again. Because I'm hands-on. I like, that's why to me, a GP particularly is somebody I want to feel close to, that they care about me. Everybody knows the hands heal, and to just do it that way it's a joke. And then having some other company, your company offer even a further away thing, a third party, please.
Thank you for sharing, Alicia. Mandy, did you want to share about your experience?
I want to share, but then I also have two quick questions. So I wholeheartedly agree with her because I was on telehealth with a cardiologist, and it was a very important call, heart related. And instead of paying attention to symptoms and what's going on and medication, et cetera, and test results, she's answering her emails the entire time. And didn't even try to hide the fact that she was doing that. You could see that she's reading emails and, responding and taking phone calls. It was just so disrespectful, and never do it again, because she's right. Hands do heal. And, if I've got a problem, I go to my doctor, who's excellent. He, feels whatever is the situation, he's always got the right answer. So just my feedback. But what I wanted to ask was, when you're saying that you would go on Zoom, are you saying, is there a special Zoom for telemedicine, or is it just the regular Zoom that we all use? Or instead of Zoom, do we go through the portal to our specific medical practice? Do they have some sort of telemedicine in their portal that's separate from Zoom?
Right, so that's very good questions, actually. First, some providers will just use regular Zoom, and they'll send you a link and the date and the time.
Okay.
Inviting you to meet with them. Others have special, what they call WebEx, that is similar to Zoom, but it's known as WebEx, that they use. They pay for that. So it all depends on your provider, what method they're using. Some of them send a link via text, and all you do is select that link in your text on your iPhone or Android or whatever, and you can access the portal where the conversation is being held. So there's so many ways to do it, that no one set way.
Okay.
Does that answer your question?
Yes, thank you.
Okay, I see Carla, you have your hand up.
Yes, I wanted to kind of piggyback on what's been said already in terms of the limitations of this telemedicine stuff, because I had a loop monitor for heart monitoring, and that was supposed to have been monitored remotely. Well, when I had the monitor removed, maybe, I guess it was almost a year ago, and the rhythm people that's supposed to have been doing the monitoring on the outside, they just tried to call me about an appointment. It's almost like they didn't even know it had been taken out.
Oh.
So that tells you how well they were monitoring. Rhythm Associates or something. Because when they kept calling me about following up. And so I finally called my cardiologist, and I said, I don't know why I'm getting this call. I said, didn't Dr. Mofred send you the report, that this loop had been taken out? Yeah, so I don't know. With everything being remote, I guess we run into some of the same problems we run into with anything else that's all remote. There's nobody really minding the store. You're kind of doing it at your own risk.
I hear you. I do understand that. We have Laverne who would like to share? Go ahead, Laverne. You're muted. You're muted, Laverne.
Okay, I got you. Hello. I just want to share my visits because I do televisit with my doctors all the time, and they're directly with my doctors. They're not with no third party or any other person involved. So I get to see them and they get to see me. And I'm very happy with my televisits because I use them per I need. Like if I feel like I have to go to the hospital or I'm at that third or fourth day and something is still persistent, I'll either call my doctor that do a televisit or I'll call the nurse line for them to guide me which direction to go if I have to go to the emergency. But I find it very helpful to have consultations as opposed to going to the office to have a consultation. I would use that time to do a consultation. So as far as the televisits I've had before the pandemic up to the day, they've been wonderful and I would recommend them highly.
Thank you for sharing, Laverne. Very good information. Harriet, go ahead.
Hello. I like the telehealth because I had a problem with my pressure going up and down. And normally they will tell you to come in to get a checkup for a reading once a week or whatever. But I spoke with my doctor through the telehealth, and she connect me to a link where I can go on the link every day and write down my blood pressure reading, and she can monitor it from there. So that was very good because I hate going in just to do a reading, wasting all my time sitting in the doctor's office. So
I
it was
hear
really
you.
helpful for me.
You wait a long time.
Yeah, I hear you. So based on what we heard so far, there are pros and cons.
Yes.
And
Yeah.
yes. And it depends on the seriousness of your, your health problem.
Yeah.
Some are minor, you just need a prescription, but they want you to come in for that prescription.
Yeah.
Whereas if with a virtual one, you don't need to.
Mm-hmm.
So that's an example of when you can, in the comfort of your home, have a virtual consultation, and then they call your prescription, and it's just a matter of going to pick it up.
Mm-hmm.
So the pros. Anybody else wants to share their experience with virtual healthcare? Someone on the phone wanting to do so?
Victor here.
Hi, Victor.
I think you need to, each individual has to sort of prioritize their problem at the time. If they're like hesitant, don't think they need to go to the doctor, heck, go ahead and do a video appointment and do that as a preliminary instead of paying a copay if you're not sure. But if it's something urgent, something infection, don't hesitate to go to the doctor. So you have to do your own sort of rating system.
Yes. That's so true.
Very good. Yep, very good advice. I would go on that too. Anyone else wants to? Sometimes, for example, let's say you travel and you're out of state and you run out of your prescription while you're traveling. A virtual visit is convenient, isn't it?
Yes.
To your own, of course, to your provider. And you don't have to be concerned about, oh, I need to get back home for that appointment while I'm visiting. I can simply call in and get my virtual visit done while I'm out there traveling. So that's another reason. Alisa, you're back. You have some more to share?
No, I have a question. My question was, see, that one of the things they noted here was that it's reduced costs. I don't know what they do. I mean, because Medicare pays it, I'm still interested in knowing, do they charge you $500 for the telehealth the same they would if you went in? I don't know. So every time, like I know for attorneys, I worked in law firms for a long time. Attorneys charge every minute. If they talk to you on the phone for 10 minutes, they write it down in their logbook so they can bill it. So I don't know if they charge the same amount or what. And the other thing is, I know that when they're really useful, so people live in rural places, like in the Dakota, South Dakota, or somewhere crazy where they don't have the really doctors. My brother just had that happen in a tiny town of Rhode Island. He was super sick. His intestine had gone up into his diaphragm and all that, and they couldn't find hospitals on the state level or local to do it. And so finally they kept searching and searching, and they gave him a 2-hour ambulance ride to Yale Medical Center. So that was his benefit. But I mean, he had to go states away to get care. So I know in a lot of cases, if you don't have people in the environment, it would be helpful.
Yep, so that's a proof for it. Thanks for sharing. Cynthia, you'd like to share. You're muted, Go ahead, unmute.
Oh, I had a glad experience when I did it because I didn't feel like catching a bus or getting Metro access and going through that. So I really appreciated the virtual thing. But one time I got so excited about it, I had to go upstairs. This was my first time doing it or second time. Had to go upstairs, get one of the ladies in the building to help me. And I waited and waited, and the doctor took maybe an hour or half an hour to come. And that kind of blew me. And then another thing I wanted to know, okay, suppose you are really, okay, you do your test and they find something wrong. Do they call you, or how do they give you the information? Do they do it? Can they do it? Would they do it virtual if something was absolutely, wrong with your test?
I doubt that. I doubt, they don't want to be responsible. They would be contacting you, probably sending an ambulance, whatever it is.
Yeah,
to get you
yeah.
out.
No, I'm saying if your test is something is wrong, and they trying to tell you that you're properly, you got cancer or you got this, how would they give you that information? Would they do it over the phone? Because we were so used to going in, to the doctor to give us the, the news. So I wonder how that would go.
Probably would say, make an appointment. We need to see you in person.
Exactly.
Yeah, that's what I was
I think
concerned
that's
about.
That's an ethics concern. How
Yeah.
would they?
How
Very
would
good question. How would
Yeah.
they?
They would tell you, make an appointment to come
Yeah.
in.
Okay, because I was wondering about that, because it'd be hurtful if they do it over the phone or if they do it virtually.
No, they do it over the phone.
Okay.
It would be brutal if they did, right?
I know.
Yes, it would.
Okay, that was
Isaiah.
it. Yeah.
Isaiah, are you there? Isaiah.
Yes, I am.
You have your numbers and your names?
Yes, I do.
Okay, so it's your thing. Take it.
All right. The range is from 1 to 23.
1 to 23. Oh, check. So the probability is greater now. You have less numbers to work with. Laverne, while we're waiting on that, Laverne, you have a question?
Yes, I wanted to make a comment to the lady that was sitting in the room for an hour with the visit. I would suggest to her, after 15 minutes, if they haven't come into the waiting room, she needs to call the office, because sometimes it's a technical problem, so don't sit past 15 minutes if they're not in that room, because it doesn't take them that long.
The doctor might have had an emergency.
Yeah, but still, if you call, they'll let you know that, because I've had that happen to me, and it was technical problems with the thing, and they were trying, but no one called to tell me, so I was sitting. So it could be anything. So after 15 minutes, I just suggest that you call them to see what's going on.
Oh, okay.
Okay, so Isaiah, you want to have the seniors select their numbers?
Okay, so will you help me with this to see who puts their hand up first in the chat, Teresa?
I sure can.
All right, so just like normal, the first person to put their hand up in the chat, I'll ask whatever number you have, and then we'll go from there. How many are we doing today, Teresa?
3. We're keeping to the 3. We have two names up in the chat already.
All right. Did you see who was
The
first?
third one. We have a 4. We have 3 now. We have 3
All right.
in the chat.
So,
Okay, so the first person's name up there is Harriet. I guess Harriet gets to choose a number.
all right.
11.
11
Okay.
is Brenda Birch.
Is Brenda there? Brenda, are you there?
Or whoever is BB. I believe BB is Brenda Birch.
She's
There's
not
too many.
responding. So that means it's lost. Next, we'll go with Mandy. You have a number you want to, your hand is up.
Let's go with 15.
15? 15 is Denise Jackson.
Denise Jackson, are you there?
Yes, thank you.
Okay. Denise, you're just a lucky person. You've been winning.
Yeah, thank you so much.
Oh my
I can buy me
goodness.
some crab legs. I can buy me some crab legs.
All right. So,
Thank you.
Cynthia, you have your hand up. Go ahead, Cynthia.
6.
Number 6,
Uh-huh.
Carol Monday.
Carol Monday, are you there?
Let's see if I
Carol, are
can
you there?
prompt her to unmute. Let's see.
Where is she? If you're not there, Carol, then it's a lost cause.
Uh-oh.
I'm here.
There you are.
I'm here.
All
You
right.
just won your $10 Walmart gift certificate. So we have one more
Thank
because remember,
you.
the person wasn't there. Thank you. So we need
Thank-
one more hands up with a suggested number. Someone who's never raised their hand up before. Someone who's never raised their hands up before. It could be because we've had that and it turns out to be your number.
All right. So, all right. So Denise put her hand up. All right.
Denise,
So
what number?
Number 20.
number 20, that is Shirley Thomas.
Ooh, Shirley.
Let's see.
Are you there, Shirley? You need to respond.
Let me see if I
This
can
is gonna
prompt
be
her to
going.
unmute.
Give her time, yes. If she doesn't respond, then we have to have someone else who is here.
Hi, this is Cynthia. What is this about?
This is about the $10 Walmart giveaway we did.
Huh?
The $10 Walmart giveaway that we get $10 gift certificate from Walmart.
Oh, okay. Okay. So
And we
but
give them away.
do I have to have a number?
No, nobody needs a number. You get
Oh,
assigned a number randomly.
Okay.
Done by whatever time, at what number do you come in?
Oh, okay.
All right, so Shirley's not there, so that one is still open. We need another number, someone who hasn't raised their hands before. Maria Stewart raised her hand. Give us a number, Maria.
23.
23.
Isaiah?
Okay. Number 23 is Yvonne Irwin.
Oh, Violet, is she there? Yvonne, are you there?
Her camera is on. Let me see if I can get
But
her.
she's not. She walked away. You've got to be there when we call that number out.
Oh, man.
She's not there. Next, not a number. We need another number. Not a number. Who wants to give another number? Not a number. Nobody wants to suggest another number?
I do.
You've already called, right, Cynthia? I'll go with
Yeah,
Vic Marina. Vic Marina
Okay.
hasn't called before. Vic,
Okay.
go ahead.
7.
Number 7,
Okay, Isaiah, who's at 7?
Ruth Clement.
Ruth Clement.
Well, finally I won something.
How long does it take to receive? Because I never got mine from 2 weeks ago.
Who is that? Well, again, we submit the names to Lou, and Lou has to get on the ball. So Isaiah, did you write those names down?
The people that won today.
Yeah, or do you want me to do it so I can go after Lou? And those who haven't received it, I want your name so I can go after him. I'm gonna be the cop. So we have, the winners are for today. Isaiah, what are the winners?
So there was Ruth Clement, Denise Jackson, and Carol Monday.
We have Denise Jackson and Carol Monday. Now, are those any online right now who have not received their $10, so I can remind Lou? They need to get them.
This is Nancy, and I didn't get one from the 3 weeks ago.
I haven't.
The one from last Friday.
So yours was from last, so Mandy, let me put your name down. I did send down your email to him, by the way. So yours was from last, let me write that down, last Friday, which was
Last week.
3/11. Anyone else that haven't received theirs?
Vic Marina.
Vic, Marina, do you remember when yours was from, Vic? So I can write down the date and remind him.
March 4. March 4.
Yeah.
It was the 4th of March?
Yeah, he came to
March
that
4.
Okay, 3/4, so I'm writing the dates down. Anybody else so I can remind him?
I haven't.
Who's high? Who's that?
Shirley Thomas.
You won, Shirley Thomas?
No.
Can you give me the date when you won?
I don't
Your
remember.
date?
I don't remember. I don't remember.
You don't remember. How many, do you remember what the subject was? And maybe I'll remember the date.
I'm pretty sure that it
What
was
taught that date?
Walmart.
What was
That
taught
No.
that date?
I don't remember right offhand. I just don't remember.
I think it was 27.
On the, what, February 27th?
But
I'll
this is
check it though. I'll look it up.
that one.
Okay.
So I'll
Okay.
have him look to see who's overlooked. So for today, we have 3 winners. And today is 3/16. It means it's $10 Walmart. Okay, so I'm gonna submit these names to him today so he can get on it. Again, it's not me that does it, it's him. So I can't make him, I can only keep submitting it to him and reminding him.
Teresa,
Yes.
I would like to congratulate all the winners.
Okay.
Yeah.
Did you hear that, winners? You're
Yeah,
being
well, thank you.
congratulated.
Yes.
Thank you.
Thank you.
Yes.
Carol Monday saying
Welcome.
thank you.
5.
Huh?
It was 225, not 27.
Was Shirley Thomas?
At 5, it was the Walmart shopping session
Who's that?
for Mandy and the other people who didn't get that one.
Also, there was the actual Walmart when I gave out to everyone.
Yeah, that
Yes.
was February 25th, I think.
He got the list from me. I gave him the list. Now, here's something though. Here's something about that one. If you did not enter into the chat box, full name and full address.
Yes, thank you.
I put it in
Colleen.
there. I did put it in there.
But if you just put your name in there, there's no way I was gonna give you.
Too much going on.
Okay, so I'm gonna stand up for that one. If you just put your name in there and half put your address, you're not entitled to one. The rule of
Name
that
and
day
my
was,
address, and I sent it to you and also to-
Andy, I
and
know
I-
yours. I saw yours. Yours is okay, but I'm speaking about the others who are saying they did not.
I put mine in there with my name and full address.
And full address. I can go to that list right now because all I did was copy and paste that list.
Yep, I
And
put
if
the
I
full
copy and
address.
paste and your name isn't there, then it wasn't there fully.
Oh, yeah.
Because I did that. And that was sent out. That list was already been sent addressed. So I will look into it, Shirley, and I would let you know.
Okay.
Any questions before we wrap it up for today? Any concerns? Tomorrow we have the library presenting. The topic is on, I think it's Whitney, the life of Whitney.
Right.
Wow, beautiful.
They're presenting on.
That's
Again,
really
there will
good.
be some giveaways again there. They're allowed to have giveaways on behalf of us. Okay?
Yeah.
So tuning for tomorrow and get another opportunity to get another $10 gift card.
Can I
Thank you,
suggest a
Teresa.
future session?
Huh?
Can I suggest a future session?
Sure, go ahead, always open. Always open.
I've always used Craigslist to sell items because I'm constantly trying to downsize, and I'd like more information about how to use other sites to sell things. Is that something you've already covered?
No, I've never covered anything on that line. I've covered just the main Walmart and Amazon, but I've never. Now I can tell you about the pros and cons of those lists, because you have to be very careful with shopping that way.
Selling.
Oh, selling. Well, okay.
Yeah.
All right, so, all right.
Yeah,
let me,
eBay
look
and
into-
Etsy, all those places.
Yeah, let me look into that.
Thank you.
Thank you for that idea, Vic. I will
Thank
look
you.
into it, and come up with the pros and cons of it. So it'll be selling on Craigslist or any other digital platform.
Facebook Marketplace.
Got it.
eBay.
Facebook, I'm writing this down, Marketplace, Facebook Market. Any other areas?
eBay, Craig's.
eBay, shopping on eBay. All right. Anywhere else you'd like me to do the pros and cons on?
Well, I mean, I've always used Craigslist. I'd like to learn better on the other ones.
Okay, I can look into that. So, all right, so that's to come. It will be on the list.
Thank
Thanks
you,
for your
Teresa.
idea. Yes. Okay, so that brings us now to the 2 o'clock hour. Those hands that are still up, is there something you want to discuss? Do I need to lower your hands for you? Okay. Hi, Oscar.
Hello,
Oscar say
dear.
hi.
I'm not going to be here tomorrow.
What are you saying, Oscar?
I never
Oscar
got
say
nothing. Wasn't that even today?
hold
I
on a
am
minute.
not
Let me
going-
mute this person. Huh?
I am not going to be here tomorrow.
Oh,
I'm
you
going
will
to-
be?
I'm going to be my doctor's
Okay,
eye
we'll miss you.
to check the temperature, the pressure of the eyes.
Okay, all right.
But Monday, meeting, the visual meeting is still on
At Cleveland.
at the Cleveland Park.
Yes.
Monday.
Monday you'll
Right?
be at Cleveland. Okay.
Okay.
Well, hope all goes best with your visit to the eye doctor.
Yeah.
Yeah, hope all goes well. Denise, your hand is up.
Oh, I'm sorry. I'm sorry.
Okay.
I thought I put it down. I'm sorry.
Anything else anybody'd like to share?
Oh, I just had one thing to say, Teresa.
Yes.
Oh, this is Shirley Thomas. I won't be able to be on tomorrow. I have to get my infusion tomorrow.
Oh, okay. So you're gonna have a health appointment tomorrow too.
Yes.
Well, good luck on that, or all the best on that.
Teresa, I have one tomorrow
Thank
too, but I
you.
hope I get back. This is Georgia. I hope I get back in time enough to get on. For
Yeah.
my eyes also.
So you
Yeah.
have help. Okay.
So I hope I get back in time to get on.
Oh, okay.
Mhm.
Wow.
Teresa, I would like to thank Yvonne for that wonderful art presentation. It was wonderful.
Yvonne, are you there? Are you online today?
I don't think she's on, but that
No,
was
I haven't seen her.
that was beautiful.
Oh, okay.
Okay. All right. Well, thank you so much. And I look forward to seeing you all tomorrow and Friday. Have a
Okay.
wonderful, blessed afternoon.
What did you say tomorrow? It's going to be on the library?
And you
The
too.
library's presenting.
Do you know the topic?
Yes, on Whitney, the life of Whitney Houston.
Oh, because I would like for the library to do the gerontology research workshop again.
Can you mention that to them tomorrow?
I will.
I'll show you something.
I will.
Okay. All
Okay.
right.
Teresa,
Yes. Hi, Oscar.
I'll show you something.
You want to show us something? Go ahead.
Yeah, look.
Uh-uh. What's that we're seeing?
You see,
You need to raise it up a little higher, higher. There you go. Yep. What is that? A prescription?
Yeah, it look like
Uh-huh.
that. Mhm.
you read.
No, I can't read it. Can't
Mhm.
read it. Can anybody read it? Because I can't.
Can't see it.
Oh, all right. I'll see you Monday.
Okay, see you Monday then, Oscar.
All right.
Okay, everybody take care.
Okay. Okay,
Take
everyone.
care.
Have a good evening.
All right.
Happy
Bye-bye.
Right, everybody. Have a
Okay,
good
bye.
evening.
And enjoy the rest.
Bye-bye.
And enjoy the rest of the day. Beautiful day.
Yeah.
Yeah, it is.
Cancer source have had hepatitis B, have been treated for heart failure, or if you have persistent fever,